After आवाज ऑफ सही सही म्यूट किया अच्छा अस्सलाम वालेकुम बेटा today we discuss with the topic related to the cardiovascular system disorders which one is the congenital heart disease. So the congenital heart disease, and they are, first of all, we can classify of the congenital heart disease. Number one, characterized by the number one, there is cyanotic heart disease, and there's increased pulmonary blood flow. Next one is the obstruction of the blood flow, and then another condition called the cyanotic heart disease, and they can comprising characterized by there is a decreased pulmonary blood flow, and there is a mixed blood flow. So they are the the three headings, and they also can be classified congenital heart disease. Number one, a cyanotic heart disease. Next one is a cyanotic heart disease, and third one is a obstruction. Okay, so first of all, we also can be, this is the classification of the acyanotic heart disease. We call it the left right shunting, left right shunt. So they can also comprising of about number one, ventricular septal defect, and the atrial septal defect, and atrioventricular canal defect, and fourth one is the patent ductus arteriosus, which one is the very important. Okay, so now we can starting and with first of all there's the defecting, there also can be occur, and with there is increased pulmonary blood flow. They also can be characterized, there is VSD, ventricular septal defect, and atrial septal defect, and third one is the atrioventricular canal, and fourth one is the patent ductus arteriosus. And then cyanotic heart is first of all, so they also can be classified, and our next one is cyanotic heart disease, and they also can be characterized, they also can be headline subheadings. Number one, there is a transposition of the great vessels, great arteries, and tetralogy of the palate, trachus artesia, and fourth one is the truncus arteriosus. In case of the obstruction of the blood flow, they also can be characterized. Number one, there is the aortic stenosis, and there is the pulmonary stenosis, and the coarctation of the aorta. So they are the three subheading comprising occur in the obstruction of the blood flow. So they are the three main categories under the heading of the congenital heart disease. So the most important causes of the congenital heart disease, the etiology is also unknown about 90 to 95% of cases, but some there the chromosomal abnormalities, and they also can be contributing. They can, in the pathogenesis of the some congenital heart disease, they also can including HD, VSD, and they are at least they are the patent arteriosus and coarctation of aorta. So they also can be contributing. Number one, these diseases, they also can be caused by the about 5 to 10% of the cases, comprising some there are the chromosomal abnormalities. They were also including number one, there is a Down syndrome. There is also trisomy. Example of the trisomy 21, Down syndrome, and also the Edward syndrome, and also can be some the Turner syndrome. So these are the some uh, genetic causes. They also can contributing in the pathogenesis of the congenital heart disease. Another causes related like the mental inherent disorders like autosomal dominant disorder and the gluconeogenesis. हाँ हाले सही है हाँ सही so congenital heart disease, and they're including the most important cause caused by the canal heart disease. They are the Down syndrome, like there's a abnormality, the addition of the one chromosome, and the trisomy 18, they're called as the Edward syndrome. Another like the inherited disorders contributing to dominant disorder and the autosomal recessive disorders. So the other causes, they are the maternal alcohol syndrome. They also can call the fetal alcohol syndrome, and some other the drugs or the chemical, some teratogens. They also can contributing in the pathogenesis of the congenital heart disease. Okay. Now we can also come discussing uh, here there is ventricular septal defect, and they also can be comprising about the 30% of the cases. So there the ventricoseptal defect, and there the 85% of the cases they are the spontaneously, and they also can be spontaneously closed. So the assessment of the cases, they will also having that the most commonly occur in the age group of the 4 to 8 weeks of the age group. This disease also can be occur. Patient, they will also can complaining about the fatigue, and they also having there the abnormal heart sound called as a murmur, and they are also having there the also the canal heart disease. They are the most important cause by the infected endocarditis. Rheumatoid heart disease, so they also can be infected endocarditis. They also can produce abnormal heart sound. There is a thrill, and they also can be easily audible with help of the stethoscope. So the echocardiography and the ECG, and also the magnetic resonance imaging. So these also can be having there is some features on this investigation about the right ventricular hypertrophy. They will also can be seen in this case of the patient of the ventricular septal defect. So the treatment of these cases is the catheterization. They are also having the catheterization, and also the surgical indication of these cases of the ventricular septal defect. So the ventricular septal defect, so they are about the 30% of the cases. 85% case they are spontaneously closed. Okay, but so the in this case right ventricular hypertrophy, they also a more common patient. They also having the fatigue. Another like the abnormal heart sound, they also can be easily heard. So now we can. This is also a clinical the gross picture of the ventricular septal defect. They also can showing the right ventricular hypertrophy. Okay. Now we can discussing with the atrial septal defect. So there's atrial septal defect. They also having the example of the increased pulmonary blood. So they also can blood from the most probably the coming from the left to the right side of the left to the right atrium. So they also can cause by the uh, characterized by the atrial septal defect. So the other defect also going to go within the blood from the most probably from the left to the right atrium. So there are the two types of these ASD atrial defect. Number one, there is the ostium primum, and there is the ostium secundum. So ostium primum, they also can be occur in the lower end of the septum. They will also can this also can be a deformity. They also can occur in the level of the lower end of the septum, and they call it the ostium primum, ostium secundum, and they will also can be called the deformity in the center of the septum. They will also can occur in case of the atrial septal defect. So now the assessment of these cases, they will also can showing the systolic murmur, and the systolic murmur they are easily heard. So now they also having their they showing their the enlarged right side of the heart. They also can become right side of the heart. So this is also a diagnostic point in case of the uh, atrial septal defect. They also can showing that the right side of the heart become enlarged, and they also can become the hypertrophy. Okay, they also can showing that they increased in the they also can increase in the pulmonary they also can occur in the pulmonary pressure. Okay, pulmonary circulation pressure. Okay, so they also have the some there the management of these cases, and they also having the catheterized repaired, and they also having there they are open heart surgery. They also can indicate it in case of the atrial septal defect. Okay, now the complications of these cases, most importantly, patient they also can developing the arrhythmias, abnormal heart sound, abnormal heartbeat, and they also having the Ebola. Ebola, they also having the this Ebola, they will also can be caused some there is a form of the occlusion of the vessel wall. Okay, now this is also HD. Now This is also a gross picture, gross features of the most importantly atrial defect. They also can showing with the right side of the heart become enlarged. Now, third condition, there is the atrioventricular canal defect. Okay, so these cases they also can be. So this is also most importantly atrioventricular canal defect. They also can occur. This is, and so this condition they also can be characterized by the low atrial septal defect. This is also called the low atrial septal defect. They are continuous and with high ventricular defect. Okay, so they will also can be high ventricular continue with the high ventricular defect and distortion of the most probably there is a distortion of the metal valve. Okay, so they're also having the metal valve and the trachea valve, and along with the continuous and so this condition they also can characterize by the atrioventricular canal defect. They can characterize by the low atrial septal defect. Low atrial septal defect they are continuous with the with the high ventricular defect, and they also there's a distortion of the most probably of the metal and the tracheal heart valve. Okay, in case of the atrioventricular canal defect. Now we can discussing the assessment of these cases. This case is also can diagnosed by the echocardiography and other like the surgery is also most probably is indicated, and for the repair of the cases, and some other the surgery is the source of the treatment. So sometimes and sometimes is also sometimes they also can need there is the new well replacement. Okay, so they will also have the new well replacement in case of the ventricular canal because the distortion of the heart valve. Treatment of these cases there are also after surgery. So after the surgery, and they are also having there the ventricle they are also having there the surgery of the most probably these cases surgery they also can be given, and there is the antibiotic for the cases of the in case of atrioventricular antibiotics after surgery. We also can give antibiotic therapy and also the anticoagulant therapy of the case of the atrioventricular canal defect. Now the treatment of the cases of these cases, there is a close and there is observation. The treatment of the case we also can give the there is the cardiac surgery and also the some there is the along with antibiotic therapy and anticoagulant therapy they also can be given. Close observation and to also can giving, and for the jaundice of the case of the in case of atrioventricular canal they are also having the close observation, and for the case of for look after for the observation of the jaundice. So this is also atrioventricular canal defect. Atrioventricular canal in this case, and they are the low atrial septal defect, and there's a low atrial septal defect. They are continuous, and with the continuous which is the high ventricular defect, and high ventricular defect they also can along with the distortion of the metal and the track as well. Okay, so this case they also can be diagnosed by different investigation by the echocardiography, and they also can give in the surgery also importantly, and for the well replacements. And so what is the close of the and then the treatment along with the after surgery, and they also can give in the antibiotic therapy and anticoagulant therapy. Now this is a atrioventricular, so both and they also can become showing, and this figure the atrioventricular dilation. Okay, there's a distortion of the both valve. So this is atrioventricular canal defect is also a gross picture. Now they also having there the another important condition of the congenital heart disease, including the patent arteriosus. They also can be from the left to right shunt. So patent arteriosus, and this is also can be Now, so patent ductus arteriosus. This also can be assessed, and for the most probably assessment of the cases, it also can be characterized by its fail to close at the birth. So they also having the defect. They also can occur within the ducts. They goes to patent ductus arteriosus. They also can fail to close at the time of the birth. So blood they will also can be shunting from the they also can be blood also can shunting and from the aorta and to the most of the pulmonary artery. So blood they also can coming from the aorta to the pulmonary artery. Patient they will also having the complete closure. They also can be occur at the age of the normally they also can occur at the age of the 3 months. Okay, there's a complete closure of the this adductors. They also can occur at the age of 3 months of age. So now this then after the more commonly they also can occur in this condition. This is more common occur in the girls and then the boys. Now, this condition, there also can be assessment of this case of the patent ductus arteriosus, and they will also having the director afterload, and they will also can be afterload and cardiac catheterization of this case of the patients of the patent ductus arteriosus. So, if the failure of the normally closure of this ductus arteriosus. Now the treatment of the cases in the infants, and they also can giving the IV or the oral therapy of indomethacin, and we also can be given 3 times and by the 3 times and 12 hours or by the 24 hours at the time. So we also can given and to also can be to lead to the some the um, close the ductus. Okay, we also can treatment of the choice of the patent ductus arteriosus we can give in the IV or by the oral therapy of the indomethacin. They also can giving and they also can be to also can lead to the closure of the ductus. Okay, now we also can be some there are the side effects of these drugs, and they also having there are the some the side effect of the drugs, and they also can be number one, there's a reduced global filtration rate, and next one, and there is the impaired, most probably impaired planet aggregation or adhesion, and third one is there is the dementia, and of the dementia there is the some there is the GIT and also the central nervous system blood flow. So these are some complications that are developing after the use of the indomethacin. Now, treatment of the choice we also going giving the catheterization at the age of the at the age of the 6 months and to the 1 year of age. We also going giving the catheterization of these cases and or surgical indication. They also can be intervention. We also can be done in the age of the at the age of the 6 month to the 1 year. Okay, so this is a most common age group, and for the catheterization and the surgical indication, and by the thoracotomy, we also can given by the thoracotomy in case of the patent arteriosus. If not treatment, they also can develop the congestive heart failure and also infected endocarditis. And congestive heart failure is inability of heart to pump enough amount of blood to meet the body requirement. They can lead to the some complication over here, and there is a left heart failure and also the right ventricular failure, and they are also having the infected endocarditis. They form the vegetations on the heart valve. They can cause the destruction or the destruction of the heart valve, leading to the infective endocarditis. So this is also a gross picture of the patent ductus arteriosus. Okay. Now we also discussing there the obstruction and the blood flow. So obstruction of the blood flow, and from the obstruction of the blood flow from the ventricle. Number one, there is pulmonary stenosis, and from the aortic stenosis and the coarctation of aorta. So these they are the subheading. They are also related to the most probably the obstruction of the blood flow, and from the obstruction of the blood flow, and from the Salim, Salim, ये सही है ना? ये सही रखिए ना? हाँ, बस ठीक है, सही सही बस ठीक है. So now we can discussing there is another entity, and the heading of the again heart disease, obstruction of the blood flow. Obstruction of the blood flow from the ventricles. Number one, pulmonary stenosis, aortic stenosis, and the coarctation of aorta. Now we can discussing number one, there is the pulmonary stenosis. They can comprise about the 10% of the cases. So now this condition they can characterize by the narrowing in the pulmonary valve. They can characterize by the narrowing of the pulmonary valve, and they can producing the pulmonary stenosis. And assessment of the case, assessment like the most for right side of the heart. There also can be failure of the right side of the heart, and they will also can be leading to the some there the abnormal heart sound will become produced, characterized by the systolic murmur and the thrills, and they will also can be easily audible on the chest with the help of the uh, stethoscope. Now ECG electrocardiogram, they are the electrocardiography. They also can leading to an echocardiography. They also can show the right side of the heart. They also can become hypertrophy. They also can show in the right heart become the showing the hypertrophy. Treatment of the choice. They also can have the balloon angioplasty. So these are the surgical intervention. They also can given in case of the pulmonary stenosis. Stenosis means failure of the heart to open completely, or failure of the heart to uh, these open completely, and also can preventing the forward flow. They also can leading to the development of the stenosis. Now this is also a case of the narrowing of the pulmonary valve. They also can showing, and that's the right side of the heart become dilated. Now because of backward pressure in the aortic stenosis. Aortic stenosis, this condition, and they will also can be comprising about these 7% of the total total cases of the canal heart disease. So they will also having their the characterized by their the increased, most probably the increased pressure. They also can occur and within the left side of the heart. Okay, left side of heart, and they are also can showing the left ventricular hypertrophy. So the assessment of the cases, and we also can showing the abnormal heart sound murmur, and they also having the thrill, and they also can be had high blood pressure in high blood pressure and the high and heart rate. They also can assess in the case of the aortic stenosis. Okay, and the treatment of the cases, they also can giving the beta blocker and or the calcium blocker, and to reduce the also the decreases the decrease the hypertrophy of this case of the aortic stenosis. In this case, they are having the giving by the beta blocker and calcium blocker, and for the reducing the chance for the hypertrophy. Now this is also a case of the aortic stenosis, and they also showing there is the increase, most probably there is increased pressure within the left side of the heart. Okay, they also can showing there the left ventricular hypertrophy. Now there is the coarctation of aorta. Coarctation of aorta, they will also can occur in the boys, and they also can be boys. They are more common and than the girls in coarctation of aorta. So now the assessment of the cases of the coarctation of aorta, they also can be High most probably in the high blood pressure, they also can occur in the upper extremities and then the lower extremities. Uh, in the lower extremities. So the blood pressure they also can be increased in the upper part of the body, upper parts of the body about the 20 mm of mercury. Mercury they will also can be which can become more than in the leg. Okay, so they will also can be in the head, and most for patient they also can be developing the headache, vertigo, and the vomiting. So in this case of the quotation of aorta. So now the treatment of the choice we also can giving the digoxin and also the some diuretics, and they also can be reducing the blood pressure and the heart contractility. So now so they are showing that the uh, surgical treatment they also can be given of these cases of the coarctation of aorta. Surgical treatment they also can be given at the age of the 2 years of the case of the coarctation of aorta. Now this is a coarctation of aorta in case of the comprising of about the most probably 6% of the cases. Now, come on the topic. There's a next next line of the heart disease, which is one of the more important, cyanotic heart disease. So, cyanotic heart disease, they also can comprising. They also can be divided. Number one, there is the transposition of the great arteries, and they also having the tetralogy of the fallet, and tetralogy of the fallet, and the truncus arteriosus and truncus atria. They are the four main airline, and they are comprising occur within the cyanotic heart disease. Now, these patients of the cyanotic heart disease, and they will also can shunting the blood from the right to the left side of the heart. So they also can developing the cyanosis, blue baby. They also can showing the in the figure there is a blue baby. Now, the most importantly, we can characterize by dividing the mixed blood. Mixed blood flow, they will also having the first of all the transposition of the great arteries, and there the and the total most probably there another one total pulmonary venous return. And third condition comprising there the truncus arteriosus, and fourth one is the hypoplastic left heart syndrome. Hypoplastic left heart syndrome. They will also can be contributing with the mixed blood flow. Now, first of all, the transposition of the greater arteries, transposition of the greater arteries, and they are the aiding of the cyanotic heart disease in the boys, which one with the more than the girls. This condition they also more commonly occur in the boy than the girl. So the assessment of the cases, and they also developing the cyanosis. Cyanotic, most probably there is cyanotic cyanosis, and from the developing the cyanosis from the birth. Okay, so the abnormal heart sound become developed. There is a murmur, may or may not be audible or the heard with help of the stethoscope. So the echocardiography they also can done and for the extensive involvement. So there the treatment of the choice in case of the transmission of the blood vessels, and they also can giving there the prostaglandin E. They also can be to most probably to keep the PDA, to keep the PDA and the opening PD opening. Okay, so they also having the surgical surgical intervention. They also can given surgical intervention. They also confirm the at the most probably and the 1 week and to the three most probably 3 months तक हम दे सकते हैं ठीक है बेटा जो सर्जिकल इंडिकेशन है they also confirm the from 1 week and to the 3 month तक हम सर्जिकल इंडिकेशन कर सकते हैं now this is a case of the cyanotic heart disease. So now there is a total pulmonary pulmonary venous, there's a total pulmonary venous return. So now they comprises only about the 2% of cases out of the total congenital heart disease. Now this condition they are also having there the pulmonary pulmonary veins, and they are also having the pulmonary return. They are return to the right side, right pulmonary turn. This condition they also can be characterized by the pulmonary venous venous return to the okay return at the most probably from the atrium or the superior vena cava or the superior vena cava instead of the superior vena cava instead of the left atrium. Okay, so this condition they also can be characterized by the pulmonary venous return and to the return to the right atrium and to the superior vena cava instead of the left atrium. Now treatment they also can give for the given the postrangular E, they also can be and and catheterization and also the other surgical intervention they also can given surgical intervention and for the in case of the total pulmonary venous return. Now, the another condition they also can give in there is the truncus arteriosus. They also can comprise about only 1% of the case of the total congenital heart disease. So, one one major one major artery and on the trunk, and they will and for the trunk they also can be arising and from the I think from the left and the right ventricle in place of a separate in the separate aorta and the pulmonary artery. So now they are also having this condition they are associating with the ventricular septal defect. Assessment of the cases they are also can showing the cyanosis. The baby has become cyanosis and they are having the dyspnea. So treatment of the cases and they also can surgical intervention. They also can it is at the intervention also can done at the age of the school going age. In case of the truncus arteriosus. Now this is also a gross picture of the truncus arteriosus. So now we also can doing the hypoplastic left heart syndrome. So this condition they also can be assessment of the hypoplastic left heart syndrome. They will also can be characterized by the infants and they also can be appear healthy at the time of the birth, but but most probably but the sign of the hypoplastic left heart syndrome they will also can be signs they will also come soon and become appear or significant at and after the ductus most probably after the ductus arteriosus closed. ठीक है बेटा, तो ये जो उसके बाद जिस तरह से जब डक्टल आर्टरीज क्लोज होता है they will also developing this type of the conditions. Now so these signs they will also can be including there the most probably including the following. Number one, patients also can developing the cyanosis, so they will also can be blue skin, they also can appear on the baby. Lips also can become blue, become cyanos, and the fingernails also can showing a cyanosis, and also because they also can be occur in the other parts of the body because parts and other areas of the body because of the mixing of the deoxygenated blood. Deoxygenated blood they will also can be the deoxygenated blood they also can be accumulated in the body part. They also can become cyanosed. In case of the hypoplastic left heart syndrome, now patient they also can developing some other like the heart murmur. Abnormal heart sound they also can be audible, and some there the enlargement of the enlargement of the heart, and they also can be as seen most probably occur in they also can be seen on the echocardiography enlargement of the heart, and they also can showing there the heart sounds abnormal heart murmurs. Okay, number three they also can showing the noticeably and noticeably there's the turbulence of the and they're also having the trouble most probably they're also having the trouble in the breathing. So patient they also can be सांस लेने में दुश्वारी होगी patient को they also can notice, and then there the apparent there the weakness. Patient they also can develop the apparent weakness, and they are also having the inability to feed normally. In patient बेटा जो है ना वो feed ज़्यादातर जो नहीं ले सकेंगे because of the patient they also can become cyanosed. So then there the uh, cold extremities of this in case of the this type of the case hypoplastic left heart syndrome. So they also can be these are the some diagnostic point and of a case of the hypoplastic left heart syndrome. Number one, abnormal heart sound. Sometimes there the enlargement of the enlargement of the heart. They also can be seen on the echocardiography. Some there the noticeably there's the trouble breathing, the apparent weakness, and they also can be show having there the inability to feed normally, and then the coldest extremities of the cases of a hypoplastic left heart syndrome. Now, so this is also a clinical diagnosis of the hypoplastic left heart syndrome. Now, these are the case of the showing in the picture. Patient they also can become cyanosed, and the affected part of the become blue. Lips are also can become pure blue and cyanosed, and the fingernails. So they are also having there the some clinical features, a clinical picture of a case of the aplastic left heart syndrome. Now, and the condition they also can be having there they occur defect they also can occur within the defect occur within the decreased pulmonary blood flow. They also can be caused by the Ductus Arteriosus, and they are also having the tetralogy of the palate. Ductus Arteriosus, and they also can be trachus valve. Trachus valve they also can be closed, and no there's a no blood. They also can be no blood, and from the right atrium to the right ventricle. In case of the trachus Arteriosus. So if they also can be a foramen oval, the foramen oval and patent ductal arteriosus, they also can be still open, and they will open and will also can be maintaining, and the good oxygen. They also can maintain good oxygen blood. So, and you have that's why you have to give the prostacyclin E2 IV therapy in case of the Ductus Arteriosus. So now the case of the if not treatment, if also can be not not severe cyanosis, they also can occur. So patient they also not severe cyanosis occur, tachycardia in case of the cases, and the dyspnea also can occur in cases. Treatment of the choice that is surgically indication they also given the Ductus Arteriosus. So this is also case of the Ductus Arteriosus. Now there is a tetralogy of the fella. Tetralogy fella they are the we also can call the T4. Number one, there the first of all there is the pulmonary stenosis and pulmonary stenosis, and there is ventricular septal defect, and these conditions they also can be occur in the tetralogy of Fallot. Number one, they are making of the four important diseases like the pulmonary stenosis, and they're the ventricular septal defect. They are the usually large, and then there is the dextroposition. Dextroposition, there is the overriding of the aorta, and fourth one is there is the uh, fourth one is the hypertrophy of the right ventricle. So these are the four conditions they are associating with the tetralogy of the palate. Number one is the pulmonary ventricular defect, and also the some there is the third one is the dextroposition, and the overriding of aorta, and fourth one is the hypertrophy of the right ventricles. Now this is also a case of the this is a clinical picture of the clinical of the picture of the heart. They also can showing that the four things. Number one, there is the pulmonary stenosis. They are also having the ventricular septal defect, and also the incorporation of aorta. So there is the and hypertrophy of the right ventricle. You can see the right ventricular hypertrophy in case of the tetralogy of Fallot. Now, thank you, Beta. So this is all of about the congenital heart disease. We can dividing, classify the congenital heart disease into three main compartments. Number one is cyanotic heart disease, comprising there the ASD, VSD, ASD, atrial septal defect, ventricular septal defect, and third one is the ventricular septal defect. Interceptal defect, ventricular septal defect, and third one the atrioventricular canal defect. So patent ductus arteriosus, they are the three main, they are the four main diseases. They also can heart disease, including in the acyanotic heart disease, the blood shedding from the left heart left to the right, shedding on the blood. And in case of the right to left, they also can comprising number one, there is the transposition of great vessels, and about second one is the Truncus arteriosus, and fourth one is the tetralogy of Fallot. Okay, in obstruction of the blood flow, number one there is the pulmonary stenosis, aortic stenosis, and coarctation of aorta. So these are the most important causes, comprising like the infant carditis, the congenital heart disease also can be including, and some of the diseases like the some there the congenital heart disease, some other the genetic disorders like the chrome abnormalities, including Down syndrome, Edwards syndrome, another the Turner syndrome, and there's the mental inheritance disorders like the autosomal dominant disorders and autosomal recessive disorders, and the excessive use of alcohol. Uh, Alcohol also can be the teratogenic, and the effect on the fetus. They also can showing the fetal alcohol syndrome, and also the excess use of the thalidomide drug. They also can cause cause the teratogenesis. They can lead to the development of the congenital heart disease. They also can be and they are all of about the classification and the of the congenital heart disease. We are also discussing over here. Now, inshallah, we can discussing next lecture on the tumors of the heart next week. Thank you, brother. Brother Salim? 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 Allah.